afternoon. My name is Karla Hopkins, and I am a psychiatric and mental health nurse practitioner at Maryville University here as a candidate for the Doctorate of Nursing Practice degree. The topic of my project is mindfulness-based stress reduction and nursing student anxiety. The focus of my presentation are the lessons learned from DNP project implementation. My committee members are as follows. The chairperson of my committee is Dr. Boniface Stegman, PhD, MSN, RN. My second reader is Dr. Jennifer Brunworth, EDD, MSN, RN. And the community member is Dr. Linda Rice, PsyD, RN. Background and significance. The aim of my project was to assess the effectiveness of MBSR, or mindfulness-based stress reduction, on the state anxiety levels of first-year nursing students. In my research, I found that nursing students experience high levels of anxiety. And actually, I didn't need to research that. I've been a nursing student for a while now, and I completely understand that. Increased stress and anxiety levels lead to poor college performance. Mindfulness-based stress reduction, however, can decrease the stress and anxiety experienced by college students in particular. Subsequently, the decreased stress and anxiety levels experienced by college students can lead to better nursing school performance. Literature review. Stress and anxiety among nursing students was one of the topics that was reviewed during this integrative literature review. 6 articles reviewed specifically addressed the stressful nature of studying the science of nursing. Increased stress and anxiety levels were linked to negative course outcomes and delayed college graduation, and potentially a failure to complete college programs, period. Increased anxiety levels decreased the students' ability to recognize patient deterioration in SimLab. So during simulation exercises at nursing schools, it was found that the higher the anxiety level of the nursing student during the simulation, the less they were able to identify deteriorating symptoms and signs in patients in the simulation lab. Subsequently, and additionally, this decrease in ability to recognize things in the simulation lab also decreased students' confidence once they got to the clinical setting and were taking care of actual patients. Mindfulness-based stress reduction, MBSR, was also reviewed, and 13 articles support the efficacy of the practice in reducing anxiety levels. One article in particular endorsed the use of this meditation modality to reduce anxiety in nursing students. The State Trait Anxiety Inventory. This is an evidence-based tool to measure state anxiety levels. The validity of the State Trait Anxiety Inventory in measuring state anxiety related to high stress situations such as coursework were at 0.73 and 0.85 respectively. State anxiety is the anxiety that is felt in the moment. And so this is the anxiety level that I wanted to use as part of my research project. The State Trait Anxiety Inventory was used in one research article on assessing the anxiety levels of nursing students in particular. My theoretical framework. The middle range theoretical framework chosen for this project was the transactional model of stress and coping by Lazarus and Volkman. Strong emotions like anxiety can overtake us. They can overtake us and exacerbate the experience of anxiety that we feel. Stress is a multifaceted transaction between a person and their environment. There are more levels to stress than just one. There are different types of stress. You have eustress, which is the good stress which motivates us to maybe study for a test or things of that nature. And then there's distress. Then the distress is what can be troubling both psychologically and also physically. This model outlines the steps taken when a person is faced with a stressful situation. First, there's an appraisal of the situation to evaluate if there's any potential danger. Unfortunately, through evolutionary times, our body reacts the same way to stress, whether it is facing a test that we are not prepared to take or whether we are running from a bear in the woods. We release the same stress hormones and we can have the same physiological effects. So we appraise the situation. If no danger is detected, we're all good. But if danger is detected, then we make a second assessment and we try to gather or get together our available resources to help mitigate that circumstance. If the stressor is still present, then we continually reassess and perform and use different coping skills and coping mechanisms. The main focus of this project was to find out if mindfulness-based stress reduction would be a good tool for nursing students to use to help them to mitigate the circumstance of the anxiety that they're inevitably going to feel and to experience studying the science of nursing. Design and methods. The design chosen was the quasi-experimental methodology. The quasi-experimental methodology uses pre and post-test interventions. The state trait anxiety inventory was chosen as the particular pre and post intervention assessment tool. Methods. 263 first-year nursing students were identified. Pre-project intervention needs surveys were sent via their school email and via proxy to protect their anonymity to these students, to these 263 identified students, to assess their need for an anxiety reduction program period at the college. After a week after that needs survey was sent out and the information was received, information about the project and an invitation to participate in the project was sent to the identified students. Now, with the needs survey, myself as the project coordinator and as the researcher asked the students about their levels of anxiety and asked if they thought that an anxiety reduction program would be efficacious. After information was sent out about the potential project, an implied consent and copy of the pre-intervention state trait anxiety inventory was sent to the students via email. The students had about 1 week approximately to complete that. After that week's time, videos with links sent via email were sent to the students with mindfulness-based stress reduction meditations, information about how to complete the mindfulness-based meditation practices. And each of these mindfulness-based meditation practices lasted about 5 to 10 minutes. The students were sent one lesson each week for 3 consecutive weeks. The students were also asked to practice this method about 4 days a week in the email. At the end of that 3 weeks of mindfulness-based stress reduction lessons, a post-intervention state trait anxiety survey was sent to the students. Students who were participatory and who completed the pre-intervention state trait anxiety survey were asked to complete the post survey. All of this was done anonymously, and each and every one of the 263 students received the same information. Sample. The study location is a college of nursing in Louisville, Kentucky, and this college is dedicated solely to nursing education. The population chosen was first-year associate degree and bachelor degree nursing students. And not only were they the first-year students in the ADN and the BSN programs, they also had to be enrolled in the Pathway to Success course. This is an entry-level course that all students at this particular College of Nursing are required to take. Out of those courses and of that population set, 263 potential candidates were chosen. Each of the candidates had to be at least 18 years of age as well. My data analysis. So, a power analysis was conducted to determine the minimum number of participants needed to test the efficacy of mindfulness based stress reduction on student anxiety. The simple t test was the chosen data analysis tool. The t test can be used to analyze data before and after an intervention with a single group of people, or it can analyze data between two different groups of people. So I chose the simple t-test because I could use it with one group of people with before intervention and after intervention data. My power analysis results. A power analysis of 0.996 was achieved with a minimum of 4 participants, meaning that I only needed 4 participants to complete the pre-intervention survey, complete the mindfulness-based stress reduction interventions, and then subsequently do the post-intervention survey. My study results are as follows in this flowchart. The study was conducted during the winter of 2021. As stated, the BSN and ADN students were chosen. Total BSN and ADN students during that quarter were 965. Of the 965, 702 of the students were excluded because they were not first-year students, or they were not enrolled in the Galen Pathways to Success program. The College of Nursing students that met the criteria, who were first-year nursing students in the ADN or BSN program, were over the age of 18 years or older, and were in the Pathways to Success class, numbered 263. Of the 263 students solicited as potential subjects for the project, 259 students chose not to respond to any of the emails sent by the researcher, myself. 4 students total chose to participate and to partake in completing the pre-intervention state trait anxiety inventory. Of the 263 students and the 4 that chose to partake in the pre-intervention survey and take the state trait anxiety inventory, none of those students completed the post state trait anxiety inventory. Respectively, no data was able to be obtained because I did not even have the minimum 4 to complete the pre and the post state trait anxiety inventory. With these results, there was nothing that I could do mainly but to learn. This was a vast opportunity for improvement and the playing field was open for me to learn from these limitations and from what didn't go well. And several limitations to the success of this project were identified. Number 1 was poor stakeholder buy-in. The needs survey that was sent out focused on asking the students if they felt anxiety and if they felt anxiety had a negative effect on school performance. 63% of the students not 63%, but 63 students out of the 263 students answered the pre-survey and said yes, anxiety is a big problem. The needs survey, however, did not ask the potential subjects if they were willing to engage in a program that would require action by them 4 days a week for 3 consecutive weeks. So poor stakeholder buy-in because I did not ask the right questions, or the researcher did not necessarily ask the right questions and then seek to tweak the project based on the answers from those questions. The second limitation noticed was the implementation of the project via email. So the inception of this project was around 2019, pre-pandemic. The project had to be changed, or some of the tenets of the project had to be changed post-pandemic. So the need for these pandemic precautions that were enacted at the school, so there was a change from in-person learning to online learning completely. And so this was a potential hindrance to subject participation because now the researcher was not able to address the students in person or to have a proxy address the students in person, and everything had to be done via email. The IRB approval process at the research location ended up being about 5 months long. Guidelines from that IRB committee relegated the researcher to communicating with the potential subjects via email using a proxy. And that was the only way that myself, the researcher, could communicate with the students. Therefore, there was no in-person interaction between even a live mindfulness-based stress reduction instructor and the participants, even via Zoom. The participants were expected to complete the lessons individually at home. And we know by now, and we've all been more familiar with terms like competing interests and so forth, that beset patients, or not patients, but beset students who have to learn in an online environment in their homes. When you have competing interests, you have children, you have laundry, you have lots of other things. So trying to complete an online classes completely and complete a project that someone asked you to participate in was a limitation. Additionally, I did not, or the researcher myself, I did not embed a monetary or a gift type of incentive for student participation in the study. Last but not least, there was an absence of a method to gather post-project evaluation information from the students so that the researcher myself can better understand other limitations that potentially hindered the success of this project. So with the discussion, the lack of participation, of course, was a great disappointment to myself, but I was determined to learn, and I want to learn from this. So several important lessons were learned by me with implementation of this study project. Number one was I needed to fully understand the IRB process and the research limitations at the location chosen for the project prior to me implementing the project. I also needed to fully understand and to know the needs of the principal stakeholders. Research showed that anxiety is just runs abound in nursing schools, and anxiety can decrease success in nursing schools. But fully understanding that population that was chosen and how much they were willing to do something about their anxiety levels was another story. And having a better understanding of that could have definitely changed the trajectory of this project. Additionally, crafting a robust evaluation process to gather additional data would have been optimal, because getting that additional data from the evaluations could help in the crafting of additional research projects. And choosing to do a project that used human participants as opposed to choosing to do a project that used secondary data, where I could have dovetailed on some data that was already gathered and looked at other aspects of research studies that were already completed, would have yielded research data that could have been usable to myself. Implications for practice. Helping to ensure that nursing students are successful in school can help increase the number of nurses in the workforce. In 6 years, it's expected to be 371,500 unfilled nursing positions in this country alone. Healthcare safety. Decreased anxiety levels in nursing students can translate into novice nurses who are more confident during that transition between student nurse and actual staff nurse. And that was something that was found in one of the research studies in the articles that I used in the literature review. Decrease the anxiety level in nursing school, increase the confidence when a nursing student gets out of nursing school and starts to practice in the real world. In conclusion, anxiety has been proven to decrease nursing student confidence and can negatively impact their school performance. Anxiety reduction methods, such as the mindfulness-based stress reduction, can reduce anxiety and has been proven to reduce anxiety in college students in particular. Colleges of nursing can benefit from incorporating stress/anxiety reduction practices as a part of the curriculum to help increase student success. Individual nursing students who make it a practice of using anxiety reduction methodologies such as mindfulness-based stress reduction can reap the rewards of increased confidence in their skills when transitioning from student nurse to novice nurse. Thank you.